Med Surg Monday, Episode 1. Tune in every Monday as we practice questions and view rationales to prepare for your Hesi Med Surg exam. We're gonna pass this. A nurse is caring for a patient receiving codeine for pain management. The nurse should prioritize monitoring for which adverse effects associated with codeine administration: hypertension, bradycardia, respiratory depression, or hypoglycemia. The correct answer is C. Respiratory depression is a significant adverse effect associated with codeine use, especially in cases of overdose. Therefore, the nurse should prioritize monitoring the patient for signs of respiratory depression, such as decreased respiratory rate and shallow breathing. This is crucial for early detection and intervention to prevent life threatening complications. A nurse is caring for a patient experiencing hallucinations. Which action is a priority in establishing a trusting interpersonal relationship with the patient? Providing constant reassurance and validation of the hallucinations, demonstrating anxiety and fear to match the patient's emotional state, exhibiting patience, acceptance, and utilizing active listening skills, or ignoring the hallucinations to avoid reinforcing them. The correct answer is C. Establishing a trusting interpersonal relationship is crucial when caring for patients with hallucinations. Showing patience, acceptance, and utilizing active listening skills helps create a safe and supportive environment. This approach encourages the patient to express their experiences and feelings. A nurse is caring for a patient in the cardiac intensive care unit and another patient in a seclusion room on a psychiatric unit. Considering the impact of sensory deprivation or overload on cognitive function, what nursing interventions should the nurse prioritize for these patients? Ensure a quiet environment in the CICU and provide auditory stimulation in the seclusion room. Implement frequent physical restraints in the CICU and minimize environmental stimuli in the seclusion room. Encourage family visits in the CICU and maintain constant lighting in the seclusion room. Administer sedatives in the CICU and encourage quiet reflection time in the seclusion room. The correct answer is A. Sensory deprivation or overload can lead to maladaptive cognitive responses. In the CICU, where constant activity may contribute to sensory overload, creating a quieter environment is essential to prevent confusion, delusion, and hallucinations. Conversely, in a seclusion room where sensory deprivation may occur, providing auditory stimulation can help mitigate the development of internally produced stimuli and promote a more adaptive cognitive response. A nurse is caring for a patient with cirrhosis who presents with peripheral edema in the lower extremities and presacral area. Which mechanism is primarily responsible for the development of peripheral edema in this patient? Increased aldosterone secretion, decreased renal blood flow, impaired liver synthesis of albumin, or hyperaldosteronism? The correct answer is C. Peripheral edema in patients with cirrhosis primarily results from impaired liver synthesis of albumin. The decreased colloidal oncotic pressure, coupled with increased portocaval pressure from the portal hypertension, leads to fluid accumulation in the lower extremities and presacral area. Options A, B, and D are related to mechanisms involved in ascites formation, not peripheral edema. A patient with cirrhosis and ascites is at increased risk for spontaneous bacterial peritonitis. Which statement by the nurse indicates an understanding of the risk factors for SBP in this patient population? The patient's acidic fluid will contain gram positive bacteria. SBP is more likely to occur in patients with a history of visceral hemorrhage. SBP is common in patients with elevated levels of antidiuretic hormone, or the risk of SBP is lower in patients with hypokalemia. The correct answer is B. Patients with cirrhosis and ascites especially those with a history of a serial hemorrhage, are at an increased risk for spontaneous bacterial peritonitis. SBP is a bacterial infection of the ascitic fluid and is commonly occurs in patients with cirrhosis and ascites. A nurse is caring for a patient who underwent gastric surgery and is experiencing symptoms of dumping syndrome. What intervention should the nurse prioritize to help alleviate the symptoms during the early phase? Encourage the patient to consume a large meal at once. Recommend drinking liquids with meals to aid in digestion. Advocate for lying down immediately after meals or suggest consuming small, frequent meals and avoiding liquids with meals. The correct answer is D. During the early phase of dumping syndrome, symptoms occur 10 to 20 minutes postprandially. To alleviate these symptoms, the nurse should recommend consuming small, frequent meals and avoid liquids with meals. This helps decrease the rapid emptying of large meals and prevents the dumping of hyperosmolar contents into the small intestine. Options A, B, and C would exacerbate the symptoms of dumping syndrome rather than alleviate them. A patient experiencing acute pain is admitted to the hospital. The nurse assesses the patient's vital signs and notes an elevated heart rate, increased blood pressure, and rapid respiratory rate. Which of the following autonomic nervous system responses is consistent with the patient's acute pain? Constipation, dilated pupils, tired appearance, or urinary retention? The correct answer is B. The sympathetic nervous system responses associated with acute pain include increased blood pressure, elevated pulse rate, and rapid respiratory rate. Dilated pupils are also part of the sympathetic response to pain. A nurse is caring for a patient in the immediate post operative period following abdominal surgery. The patient is experiencing acute pain and exhibits restless behavior, pacing, and grimacing. During the assessment, the nurse notes an increased heart rate, elevated blood pressure, and rapid respiratory rate. Which intervention is most appropriate for managing the patient's acute pain? Administering a laxative, encouraging urinary retention, providing a quiet environment, or withholding analgesics? The correct answer is C. The patient's behavior, such as restlessness, pacing, and grimacing, along with increased vital signs, indicate a sympathetic nervous system response to acute pain. Providing a quiet and calm environment can help reduce stimuli that contribute to the stress response. Administering analgesics is also an essential intervention for managing acute pain and should not be withheld. A nurse is caring for a patient from a culture that encourages stoicism and discourages outward expression of pain. The patient is experiencing pain but is not displaying typical observable indicators such as moaning or grimacing. What is the most appropriate action by the nurse to assess and manage the patient's pain? Administer a pain relief medication without further assessment, consult the healthcare provider for alternative pain management strategies, educate the patient about the importance of expressing pain openly, or utilize nonverbal indicators such as blood pressure, heart rate to assess pain. The correct answer is D. In patients who may not express pain outwardly due to cultural reasons, nonverbal indicators such as vital signs can provide valuable information. While it is essential to respect cultural differences, utilizing physiological measures can aid in assessing the patient's pain level and guide appropriate interventions. An elderly patient is admitted to the hospital with complaints of stiffness and discomfort. The nurse recognizes that the patient may use alternative terms to describe pain. Which descriptive term is commonly used by the elderly to express pain? Excruciating, throbbing, aching, or nauseating? The correct answer is C. The elderly may use terms like aching, soreness, stiffness, or discomfort rather than explicitly using the term pain during assessments. Understanding these alternative expressions is crucial for accurate pain assessment and management in the elderly population. Subscribe and join us every Monday as we practice questions to prepare for your Hesi Med Surg exam.